Next on Time for Living, arming yourself with knowledge to avoid prostate cancer.
You can call Lucille Tregonown Mrs. Goodwrench. She's getting this week's second effort salute.
And we head off to exotic Singapore in today's Traveling Around segment. All this and more next on Time for Living. Trailer.
And I'm Janet Jagalian. Welcome to Time for Living.
Now, if you're over 50 or if you have friends or family over 50, this is the show for you.
Every week we present stories of interest to you, and sometimes the stories are fun and nostalgic. Others are more serious, yet very important.
In today's lead story, it's a very serious nature, but many of us have asked for a show like this to cover this important topic. We're talking about prostate cancer. Now, last year, more men died of prostate cancer than in highway accidents. And Time for Living Steve Brown introduces us to one prostate cancer survivor who's doing all he can to educate men and women about this deadly disease.
The topic is prostate and prostate cancer.
Stanley Klein is a man on a mission. The retired Raytheon engineer is once again talking about a subject many men don't want to talk about: prostate cancer.
Now, who gets prostate cancer? It turns out that usually men over 50 get it. If you happen to be of the black race, Afro-American, or a man of color, it starts 10 years earlier.
The numbers are staggering. Last year alone, nearly 250,000 men in the United States were diagnosed with prostate cancer. Another 43,000 men died of the disease last year. No one knows for sure what causes it, although high-fat diets are suspected. It's no wonder prostate cancer is a major concern for men over the age of 50.
Just turned 60 years old, and I feel my body changing, and I just need some answers, basically, that's it. I've been going to doctors practically all my life because I'm asthmatic. And so it's really nothing new to me, but I just keep it up, That's all. That's why I'm here.
I had my prostate operated on about 5 years ago, but everything was all right at that time. But I'd like to keep a check on it.
I had a kidney transplant, and I'm just wondering how that would affect the prostate gland. I've got prostate problems.
It's a very ugly operation to begin with, and the word is getting around it's better not to get it.
These men, along with dozens of others, have gathered to listen to Stanley Klein. A survivor of prostate cancer, Stanley gives nearly 100 talks a year, urging men to get tested for the disease. Stanley believes that test saved his life.
The doctor told my wife that if I had not decided to go in for this routine physical, or if I had not asked for that blood test, and if the doctor had not done it, that the chances are I would have been a stage D probably within a year. And so at least I'm very optimistic that having both the surgery and the radiation, that I have both the belt and suspenders, and maybe might have a normal life expectancy.
The blood test Stanley talks about is called the prostate-specific antigen, or PSA test. Developed in the mid-1980s, the test can indicate the presence of cancer long before any symptoms arise.
This is done right in your primary care physician's office. When he takes the blood to check your cholesterol and your complete blood count, they just have to circle one extra test, just says PSA. And it's an extra charge. The laboratory charges extra for doing that particular assay. But it's something now that I know Medicare pays, and I believe, I've been told, many other insurance companies do pay for it. If you're close to that age, they won't do it for a man who's 30 unless there's some real reason.
Stanley believes every man over the age of 50 should get the test. But within the medical community, there's a debate over testing and what to do with the findings.
All right, if we detect early prostate cancer, is this a type of cancer that is going to be a problem, or is this a type of cancer that is just indolent and does not require aggressive treatment, but just requires monitoring. Now, one of the problems we have is if we detect something, we have a whole repertoire of potentially aggressive treatments to offer. And this may turn out to be the old story. The treatment is worse than the condition you're ending up trying to treat.
I'm going to be hard to
Dr. Loring Conant is a primary care physician at the Cambridge Senior Health Center in Cambridge, Massachusetts. He says elevated PSA levels do not necessarily mean prostate cancer.
It may be just because you have what is called a condition, occupational hazard of males, as we get older, benign prostatic hypertrophy. And you can have elevated levels in that condition, which is not a malignant condition, particularly if you have a smoldering infection. Matter of fact, the highest levels, with a few exceptions of really advanced cancer of the prostate, that I've seen have been in non-malignant situations.
So what happens if your PSA levels are high? Your primary care physician may then refer you to a urologist.
What he'll want to do, he'll want to examine you just as I have. He'll do a rectal exam. And he may want to get an idea of if there is some if there's more involvement with the prostate by the use of what is called an ultrasound technique. That's not a very good technique for screening because you can never tell a benign process from a malignant process, but at least it gives you an idea of the architecture of the gland and where my urology colleague will want to take some samples. And what he'll do is, and this makes a lot of males cross their legs, say that we're going to do a needle biopsy. It actually is quite a well-tolerated procedure, and he's guided by doing this by what the ultrasound has showed him, also by what he palpates himself. And it's important to take a number of those samples because that in itself may miss some areas. And then what is important is that when he gets the report back, he and I talk about the results, and it's not the extent of elevation of the PSA that's important. It's really what it looks like under the microscope.
If a man has a brother or a father and has a close blood relative, his chances are twice as high of getting prostate cancer.
While doctors debate the merits of screening, Stanley Klein remains on his crusade for prostate cancer awareness. When he retired 3 years ago, he never expected to go on the talk circuit, but he is finding his new work most rewarding.
It is rewarding in the sense that I feel I am trying to save lives. And that is very rewarding. If I give a talk and one man goes for a checkup and he finds he has a problem before it's advanced, that's a reward right there. If I can save one man per talk, that says so in the past year, if I've given maybe something like maybe 60 talks, if I could have saved 60 men, I'd be thrilled. I'd be thrilled.
I'm Steve Brown, Time for Living.
I'm pleased to welcome to the studio Dr. Paul Church. Now, Dr. Church is a urologist from the Faulkner Hospital and the Deaconess Hospital here in Boston. And it's a pleasure to have you here to talk about this topic that is of grave concern to a lot of people, and perhaps some mystery surrounds it as well. But it's become very clear to me, Dr. Church, that the numbers are kind of staggering and kind of frightening. 1 in 11 white men, 1 in 7 black men likely to develop prostate cancer. Is this the way the numbers have been running for years, or is that number getting more dangerous?
Well, the numbers are actually increasing, and we're very concerned about that. Not only the number of cases being detected, but also the death rate has gone up gradually over the years, too.
It's up to, what, about 40-some-odd thousand a year?
Probably going to be over 40,000 men this year.
One would think, though, with the advent of the PSA test and the fact that men are perhaps more aware of this screening, that they would take advantage of it and would perhaps detect it more at an earlier stage and therefore have a better chance of survival.
Well, we've certainly seen that with the PSA testing, we were able to detect the disease much earlier than ever before. And the cases that we are able to diagnose in a confined state now represent 2/3 or more of the new diagnosis. And that's an excellent change from what it used to be.
Tell us about the PSA test and what the normal range is and when people should begin to get alarmed and perhaps think about the next step.
Well, PSA is a type of protein that's released into the bloodstream and can be picked up with this test. Normally, there's levels less than 4 that are circulating in the blood, and when the level is over 4, it's usually a signal that there's some kind of prostate disease. Not necessarily cancer, but there's some condition of the prostate that deserves further evaluation.
And then what should the individual do?
Well, they usually have had their test done with their own doctor, and their doctor will presumably refer them to a urologist at that point, who will decide whether a biopsy should be taken.
And is the biopsy always conclusive, or is there a possibility that it may not register what is actually taking place?
Well, the biopsies are just small samples of the prostate gland. They cannot possibly represent everything that is present inside the prostate gland at any one time. They're just little snapshots of fragments of the prostate. So we could miss a small cancer with the first round of biopsies, and that's why some men end up having 2, 3, or even 4 sets of biopsies.
Let's take a quick call from Sal from Seekonk. You're on Time for Living, Sal.
Yeah, I've been taking Hytrin for quite a while now, about 2 years, and I had that ultrasound, didn't show anything, and I wanted to know with this prostate cancer, is there any chance of, do you have pain when you have that?
What are the symptoms, Dr. Church?
Well, the symptoms in the early stages are usually minimal or completely absent. The symptoms that we commonly see are not caused by the cancer itself, but they're a result of prostate enlargement, which is also very common in older men. So I don't think that I would recommend waiting for symptoms to develop. Now, the Hytrin that you're taking is a medication to relieve urinary symptoms caused by prostate conditions, but not specifically cancer.
Is frequent urination one of the symptoms that one
It can
should
be,
expecting?
but it's very common with the benign enlargement of the prostate too. So it wouldn't be specific to prostate cancer by any means.
Sal, have you seen a urologist?
Pardon me?
Have you seen
I did, but then I heard about the next test involved and a little bit war stories on the surgery, and I just kind of said, forget it.
Do you know what your PSA level is?
No.
That would be a good first step, wouldn't you think, Doctor?
Yeah, it would really help to know what that is.
Well, see if you can check that out, Sal, and we thank you very much for the call.
Okay, thanks.
All right.
Bye.
Now, he mentioned options, and let's talk about some of the options. You've heard of radiation and chemotherapy and not doing surgery at all. You know, when are these things advisable, and what are the criteria for that decision?
Well, it kind of breaks down into whether it's an early diagnosis or a late diagnosis, but when prostate cancer is detected early and the person is, the man is of age that he's likely to live for 10 years or longer, we think he'll benefit from treatment. And the common treatments available are radiation therapy and surgery. There are some men with very small cancers of the prostate that may choose to not have immediate therapy because the cancers are so slow growing.
Can you tell early on whether it is the fast or the slow growing variety?
There are some indicators that we use in terms of how the cells look under the microscope and what their PSA levels are, and the results of
that should help in the
X-ray
decision.
tests. Yeah.
Let's take a call from Vincent in New Hampshire. You're on Time for Living.
Okay,
Yes.
Very good. Name is Vincent. I'm up here in Bow, New Hampshire. And, about a week ago, I saw a special that they had. A fellow doctor down in Johns Hopkins, he has a new technique for removing the prostate, which he does it in a bloodless field. And I watched the whole operation, and I thought it was quite amazing how he went in there and they kept the blood to a minimum. They actually scunned the prostate out, was able to leave the nerves for his penis intact, so he has function and such. And I was just wondering if I'm sure you know about it, but if you would comment on that, please.
Sure. I think you're referring to what's commonly called the Walsh procedure, and Dr. Walsh has been a very important person in the development of this operation that is able to spare the nerves that travel very close to the prostate that are responsible for male sexual function. So many of the men that used to become impotent after surgery are now able to continue to be sexually active.
And this has been another concern that people have expressed in the past, aside from the incontinence problem, the impotence problem as well. So steps are being taken to safeguard about that. Thanks so much for your call, Vincent.
Okay, you're welcome. Thank you.
And when we come back, Time for Living will continue. We'll take your calls for Dr. Paul Church. And if you have any questions about prostate cancer, do give us a call. Our number here at Time for Living is 617-244-3344. Stay with us. We'll be right back. Welcome back. I'm here with Dr. Paul Church, a urologist from the Deaconess Hospital and the Faulkner Hospital, and we're discussing a very serious issue, that of prostate cancer. And I wanted to, before we go back to the phones, just ask you quickly about diet, because everything I've read indicates that high-fat diets are definitely linked in some way to prostate cancer, as they are to breast cancer.
The evidence for that comes primarily by looking at the incidence of prostate cancer in different countries around the world. And Asian countries that where a high-fat diet is not common have very low incidence of prostate cancer, whereas in the Western world and in our own country, the incidence of prostate cancer is high and it's increasing.
But I understand as in the Asian countries, as their diets become more westernized, their incidence rate is increasing as well.
And that's true.
Yeah. Paul of Arlington, you're on Time for Living.
Yeah, thank you for having me on.
Yes.
Doctor, I'd like to ask you, I keep my checking my prostate for the last several years. I just had it checked in July, and my PSA is, it went from 4.5 to 6.5. So I was wondering, is that a normal thing to happen, or?
It's a little worrisome when a PSA changes like that. There are other reasons besides cancer that might cause it to jump around, but that's usually reason to be concerned, and to have it repeated sooner than a year and perhaps consult a urologist at this point already.
What's your doctor said?
Well, no, the doctor said he wants me back again and maybe have to have an ultrasound. And, but I'm staying on top of it because, but when I had it checked in his office, everything is, every time I had it checked in his office, it was fine. So, and I was just wondering.
Well, good luck to you, Paul.
Thank you very much.
Thank you for your call. Jim from Peabody, you're next on Time for Living with Dr. Church.
Yes, hi. I just got a brief question. I'm in my mid-30s, and I'm frequently urinating more than I think I should be. The color is very, very yellow, and I was diagnosed with diverticulitis extreme. I don't know if that has anything to do with it. Probably not. But I just would like your opinion.
On the relationship, is that what it is?
Yeah.
With diverticulitis?
I don't think it's related. In terms of prostate cancer, if that's on your mind, prostate cancer is extremely uncommon in men before the age of 50, so that would not be high on the list. There's probably some other condition of your prostate or bladder that's causing those symptoms.
Go ahead.
We thank you very much for your call, and good luck to you. Dr. Church, we talked about diet. Is there anything else that can predispose a person to this kind of cancer? Is there a genetic link?
Well, we do know that certain families have a higher incidence of prostate cancer beginning at an earlier age. So if a person has a father or brother with prostate cancer, their risk of getting prostate cancer is at least double what the average male would be.
So your advice to him at this point would be to certainly be careful of their diet.
Yeah, especially with the diet. In addition to the high fat content of diet, there's evidence linking prostate cancer to vitamin A, vitamin A having a protective effect usually, and also to vitamin D, which may have an inhibitory effect as well. It's not really clear just yet what the best content of a diet should be to try to prevent prostate cancer, but it is pretty clear that the American diet is too rich in fat.
Could you, for the benefit of our audience, explain in layman's terms what prostate cancer is?
Well, the prostate gland is a male sex gland beneath the bladder and is responsible for producing some of the fluid that bathes the sperm and adds nutrients to the sperm. It has no function for urination, but because of its location underneath the bladder, it's very common for prostate conditions to affect urination. Cancer is the uncontrolled growth of some of the prostate cells that have the potential to spread throughout the body as cancerous cells.
But I understand that a third of the male population, by the time they reach 85, usually have an enlargement anyway of the prostate. Is that reason for concern, or that's just normal maturing?
Well, there's two types of changes in the prostate. One is the benign change that you're describing, where the prostate enlarges, and the other is the incidence of prostate cancer, and they both increase with age. They're probably not directly linked, but because they're both occurring commonly as the male ages, you can see the two together.
Let's take another call. Bruce, go ahead. You're on Time for Living.
Yes, can you hear me?
Yes.
Yes, thank you. Please excuse me if my voice is just a little bit shallow. I'm just a week and a couple of days out of the hospital, having had a radical prostatectomy. And one of the things that I wanted to mention, by the way, my PSA showed up at 4.4 last March, and that's when I aggressively took a look at what was going on.
What were the steps that you followed, Bruce? Did you have a biopsy right after that?
Right after that, I waited 2 weeks to have another PSA just to check it out, and it was a little bit higher. And then I had my urologist treated me for what he thought might be an infection. At the end of the infection, we waited 10 days for the antibiotics to clear and had another PSA, which continued to rise, at which point I had a ultrasound and at the same time a biopsy. And the biopsy came back 3 of 3 positive for prostate cancer.
How old are you, Bruce?
48. One of the things that I wanted to mention to people was that that everybody talks a lot about the statistics, and I had just heard you say that it's extremely rare in men under 50 to have prostate cancer. But one of the things that I was told and that I firmly believe in is that statistics are great if you're looking at the aggregate of people, and they're also very good if you're looking at trying to predict what's happening with a certain population of men. But when it comes down to the individual case, statistics don't mean anything. So that if you have any suspicion at all that your prostate, in my case, my PSA was supposed to be normalized at about 4. So if you have any suspicions at all that you are above what your normalized, whatever your and your doctor agree your normalized PSA should be.
Well, your prognosis sounds good, Bruce, I would think, at this point.
It sounds like you got it detected very early after all. Is there prostate cancer in your family?
I'm sorry, we have run out of time, Dr. Church. Unfortunately, we could continue, I'm sure, for the next 20 minutes or so, but I want to thank you so much for spending the time that you have today, and perhaps we can pick up on this again at a later time. Thank you again. It's Dr. Paul Church at the Faulkner and Deaconess Hospitals. You know, caregiving to Alzheimer's patients can be a difficult and stressful job, especially for family members. Nursing homes are only one answer, but many early to middle stage patients are still quite mobile and able. And in today's Newsbreak segment, Time for Living's Carolyn Murdoch tells us about one new emerging trend in caregiving.
This single-family home sits in a quiet wooded community in suburban Washington, D.C.
It looks delicious.
It's home to these 6 women. They're not related, but they do share one common bond: Alzheimer's disease or other dementias.
We really believe that if you create an environment that they're used to and that they've grown up with all their lives, it minimizes their stress, minimizes their confusion.
This home is an example of an emerging trend: community-based care for Alzheimer's patients rather than nursing homes.
If you've been to a nursing home and you've been here, there's no comparison. This is like my mother's still in her home. It's just a different home.
Put it in now.
Put it in now?
Yes.
Okay. Good. Great, June. Great.
Here's the philosophy: the environment is modified to match the needs of the residents.
What we try to do is to find out as much as we can about each individual resident and find out what their past lives have been like and incorporate what their past is about into the present.
If they used to enjoy gardening, they still can. Same with cooking. They also help with daily activities, such as housekeeping and setting the table. The atmosphere, some studies say, slows the effects of Alzheimer's.
What they're finding is that it keeps the people functioning cognitively longer. It keeps them healthier longer to be that involved in their own care.
Do you have a 7? If you don't, then you draw from the power here.
And one unexpected advantage is the relationships developed here. Families say it's turning into a kind of older adult sorority house.
Okay, it's your turn. That was good, Laura. That was a good play.
I'm Carolyn Murdoch. Time for Living.
Officials from Cedar Creek Associates, the parent company that owns and runs the group home, say they train their staff specifically to handle patients with dementia. Well, up next on Time for Living, we'll go under the hood with Lucille Treganown, a 66-year-old auto mechanic who's getting this week's second effort salute. So please stay with us. I love my car when it's running well, but when it isn't, well, that's another story.
Well, the cars of today are so complex you can hardly recognize anything under the hood.
But sometimes you need to know some of the basics in order to help your mechanic solve any problems and keep your car running smoothly.
Well, thankfully, there's Lucille Tregenown. Lucille is a 66-year-old auto guru who's helping make auto maintenance a less intimidating experience. Time for Living's Rod Fritz introduces us to Lucille, who gets this week's second effort salute.
For the last few years, Lucille Tregenown has been a familiar face to Pittsburgh TV viewers. The 66-year-old divorced mother of 3 has been offering advice and tips on what she knows best: auto maintenance.
Everyone should learn about their car, and they're able to. If you work it the right way and separate all the systems before you put them back together again, it helps tremendously.
Lucille doesn't look like your typical auto mechanic, but don't let her appearance fool you. She really knows her stuff. She started learning about cars back in the early 1960s when a failed marriage forced her to get a job as a bookkeeper in an auto repair shop.
And I found myself in a growing business where the owner would say, "I'll be right back," and then he would be gone a long time. And I sounded like an idiot. I don't know, wait, I don't know, wait. And so I decided that if I was going to survive my temporary job there, that I had to learn enough to talk like a pro. So I started studying repair manuals and got enough information that I could talk intelligently to customers, sort of fake what I do. But something happened as I would read about what caused automobiles to do what, that I was thoroughly fascinated. And I think, oh my gosh, is that how that works? And before long, I was really studying for real.
Before long, Lucille was a partner in the business and later opened up her own chain of transmission repair shops. She's at ease being a mature woman in what's considered a man's business.
I have a way of handling that if someone should insist on speaking to a man. And this happens more with a couple of my employees, young women, and one especially takes offense at it. If someone, "I want to talk to a man, give me a mechanic." And so what I've taught them to do is call a man from the shop, call the dirtiest one, and hopefully the dumbest one. And so here's your, here you are, excuse me, here you are, sir. And when the man looks at the young man and asks him a question, then he in turn will look at the woman and get the answer, then give it back. And pretty soon the man gets the drift.
Lucille's fame is now spreading beyond Pittsburgh. She's written a book about caring for your car and recently made an appearance on The Late Show with David Letterman.
Do me a favor, please welcome the Martha Stewart of auto mechanics, Lucille Tregenown. Lucille.
Lucille says the cars of today are too complex for most do-it-yourself mechanics. She wrote her book to help people identify automotive problems so they in turn can assist their mechanic in getting the job done right the first time.
The book is definitely written for the person who is unfamiliar with cars. And we've done it in such a way, hopefully, that it will encourage someone who didn't think they would ever learn anything about a car to be sort of motivated to do so. And we cover the operation and then break down different problems into different segments, like we've got a chapter on leaks, how to identify those, on noises, on smells, and then some advice on looking for a car and some little extras. And once I'm in...
Lucille's success is growing. Her show is now seen coast to coast on the Home and Garden Channel, and she's hoping to open up more car care clinics.
And remember, don't go out on the road without stopping by the car care clinic.
Happy motoring, Lucille. I'm Rod Fritz. Time for Living.
Lucille's book is a must for anyone with a car. It's called Lucille's Car Care Book, and it's available at bookstores everywhere. Good for you, Lucille.
Up next on Time for Living, our Traveling Around segment. It takes nearly a full day to get to Singapore, but we'll bring you there in just a few minutes. Don't go away.
Well, I've been to a lot of places in the world, but there's one part of the world I've yet to visit, and that's the Far East.
Half a world away, the Orient is a fascinating place with fascinating people.
Well, thanks to the magic of videotape, we can get a taste of the Orient, and specifically Singapore, which is today's traveling around destination. It's a place washed clean almost daily by tropical rain, a spotless speck of land halfway around the world. The word exotic seems invented for Singapore. Most of Singapore's 2.5 million people are Chinese. But look around. You'll see many others: Malaysian, Indian, Arab, European. A visit to Singapore seems like a visit to 5 or 6 countries in one. Singapore has one of the busiest ports in the world. The economy is booming and unemployment is very low. Crime and illegal drugs are almost non-existent. 85% of the population lives in government housing, and despite all the new high-rises, there's still plenty of room for parks to preserve the island's tropical flavor.
It looks like New York, but without the defects of New York and without the garbage. Fantastic.
Most people know very little about Singapore, where it is and what it is. Well, it's a former British colony, once a part of Malaysia, now an independent nation. Singapore sits at the southern tip of the Malaysian peninsula, just 1 degree above the equator. You'll find a lot of tourists here, but very few from the U.S. It takes more than 20 hours to fly to Singapore from the West Coast, and 2 days to recover from jet lag. Still, Singapore is trying to attract more Americans. Their goal is to show that the food, the flavor, the shopping, and the hospitality are worth the long flight. Singapore's roots go back to the 17th century. But in 1819, this man, Sir Stamford Raffles, turned a sleepy fishing village into a British maritime base, a modern port, and eventually the marketplace of Southeast Asia. Today, Raffles probably wouldn't recognize most of Singapore, but Singapore still has much of the old world charm. A huge restoration program is well underway, and that means you can still wander through Chinatown, a place rooted in the past, yet brimming with new life and energy.
90% luck, huh?
Here there are fortune tellers and snake charmers. You can try exotic fruits or just sit back and enjoy the endless stream of humanity. The people are friendly, the sights exotic and unforgettable. A few blocks away, another world, Little India, a place to shop for fine silks or bask in the aromas of incense and jasmine flower garlands. Singapore is a melting pot of 30 different cultures and half a dozen religions. Here you'll find Muslim mosques, Hindu and Taoist temples. It's remarkable and refreshing to witness the religious tolerance, so rare elsewhere and so common here. Singapore is a surprising place. It's got plenty of the exotic attractions of the Far East, but it's modern, clean, and safe without the hassles you'd find in other places. Half a world away, Singapore, our traveling around destination.
Welcome back to Time for Living. It's time for our Health, Finance, and More segment, where we provide you with what we hope is helpful information that will make your financial security in the later years more stable and prosperous.
That's right. You can never be too prepared financially. And as usual, the person that brings you this valuable information is Time for Living's financial expert, Steve Burke. Steve?
Hello. Many of you have asked, how do you pick a financial planner? How much does it cost? What takes place when you work with a planner? Finally, what can you expect for results? We've touched on this in the past, but today I'll try to be a little more specific. First, how much does it cost to work with a financial planner? There are 4 basic approaches to cost. Fee-only planners charge anywhere from $25 to $300 per hour, not unlike a good attorney or accountant. Commission-only planners work on the commission they receive if you buy a product from them. Then there are those who charge a fee and also receive a commission if you buy a product through them. Last are those financial planners who charge a fee but credit any commissions received against the fee, which many times wipes out any fee. Certainly one of the first questions you should ask of a planner is, how are you compensated as a financial planner? If you don't like the reply, that's a good time to halt the discussion. If you're not sure that you understand the answer, ask to have more of an explanation or an example of your possible charges. If the planner is not cooperative, it might be best to look elsewhere. If your financial situation is fairly simple, the bill should be a moderate one. The planner should be able to give you a pretty accurate idea. After all, he or she is a financial planner. Or you might suggest that you don't want to spend more than a certain amount of money. If you sense that the planner is being uncooperative or doesn't understand the point you're trying to get across, the odds are that the chemistry between you is not good. It's time to reconsider doing business with that person. On balance, you will find most people in the area of financial planning to be good and helpful professionals. Unfortunately, as in any profession, there are a few individuals who are less than ethical, but your common sense will generally help you differentiate between the good and the bad. One clue, if it sounds too good to be true, it probably is, so be very cautious. What occurs when you begin to work with a planner? You should be prepared to be very candid with the woman or man you are dealing with. I'm sure you can recognize that anyone trying to help you needs straight answers to their questions, which many times can be very personal. Without honest replies, the questions financial planners lead a client down the wrong path without knowing it. This is not the type of activity either you or your planner wants to be involved in. Whether your interest is retirement planning or planning to help someone's educational needs or estate planning, it is very important that you know what you want to accomplish. This means the amount of money or income or return which you want to realize for yourself or someone else, and when. This saves time, which is chargeable, and also makes it much easier for your advisor to come up with more definite suggestions for your approval. The last part of the planning process is the knowledge that initially there may be backing and filling, as I call it. This simply means that some of your initial ideas may need to be modified or actually put off or dropped. That's not bad, because you must remember that all decisions are yours. So if you change something, it's because you feel that's the best idea at the time. One of the most difficult areas to deal with in the financial planning process is having your planner tell you some things you don't want to hear. This can be simple and straightforward, such as you can't accomplish that goal without investing more time or money, or there is no guarantee that strategy will stand legal scrutiny. So what is the end result of doing a little or a lot of financial planning of the retirement, estate, or other kinds? You shouldn't have a big bill to pay if your financial position is fairly simple, and you should have a very clear idea of what your options are and a track to run on. Not a bad use of a modest outlay. If your personal situation or financial condition presents a more involved puzzle, there could be more expense and activity called for. But again, I submit a clear indication of where you are and how to get where you want to be. Because we all know that things change, the last point to keep in mind at all times is it's important to pay attention. If something happens or you feel something is not as you expected, contact your financial planner and ask lots of questions until you're satisfied with a good financial plan. You are in a position to travel the course you're happiest with. And at the same time, make some course corrections if you feel you should. This is Steve Burke, Time for Living.
Great job, Steve. That's Steve Burke of Coordinated Financial Planning. If you have any questions for Steve Burke, then you can mail them to Time for Living, care of Health, Finance, and More, P.O. Box 1698, Framingham, Massachusetts, 01701 9998. And coming up next on Time for Living, our weekly check of the mailbag. Find out what viewers said this week, or if your letter will be read on the air. Stay tuned. We'll be right back. Welcome back to Time for Living's Mailbag segment, where we read your letters on the air.
So if you have any questions or comments about past stories, places we've been, people we've profiled, then drop us a line.
Now, our friend Bill from Boston writes, Dear Time for Living, I got a real kick out of your show this week on the anniversary of Revere Beach. That's the 100th anniversary. I can remember many times going to that beach with the family and taking a swim. Not to be forgotten was the chance to play the arcade and get on some rides. Things seemed a lot simpler then, the pleasures more cherished, and your trip down memory lane was a real thrill and a great treat. You know, we're so glad that you enjoyed that trip, Bill. We enjoyed bringing it to you, too. We got lots more to follow.
You know, a lot of you keep calling our 800 line to leave encouraging messages, and we certainly appreciate your taking the time to get in touch. Here's a message from New Hampshire. Dear Rex and Janet, I caught part of the financial segment planning, and as my husband is going to be retiring in about 16 months, there were really some good suggestions. It looks like we have pretty much covered all of our bases. And that was really helpful. I wanted to thank you so very much. I really do love your show, and I really get a lot out of what you present. So keep up the good work. Mrs. Morrison in New Hampshire. It's letters like this that make this job so much fun. So thanks to everyone who took the time to write to us, and to those of you who haven't, we'd love to hear from you too. Our address is Time for Living Mailbag, P.O. Box 1698, Framingham, Massachusetts 01701.
Or you can call our voicemail and leave us a message at that number, and it's 1-800-232-7213. Give us a call.
And coming up next on Time for Living, a look ahead to next week's show. So please stay with us.
Bill. Well, thanks so much for joining us again today on Time for Living. We hope you enjoyed our show.
If you'd like to travel, you'll definitely want to tune in again next week. We'll be looking at travel trends for older Americans. Seniors are hitting the road and visiting all sorts of places, and we'll tell you all about it.
And of course, we'll have our regular features, health, finance, and more, and our second effort salute.
We leave you now with one more look at the exotic country of Singapore. In the meantime, remember, it's time for living.